Hello everyone, I am Dr. Rajkuwar and today I shall be discussing teething, what to expect and how to keep your baby comfortable. Teething causes teeth and nothing more. It is a process and your baby is teething long before a tooth actually erupts in the mouth. Some mothers don't even realize that their baby has a tooth until they hear it click on the spoon, while other babies scream for almost 2 weeks before a tooth comes in. This difference lies in their threshold for pain. Babies are born with all 20 primary teeth below their gum line. An average baby gets its first tooth around 6 to 7 months of age. However, some babies are born with 2 teeth while others get them around 14 months of age. Most dental professionals are not concerned about the lack of teeth until around 18 months of age. However, if you still feel worried, then please consult your dentist. But do try to remember that each child is different and meets some milestones early and some late. Most parents believe that their child is teething as soon as they start chewing onto things, which is typically around 2 to 3 months of age. This is not a sign of teething. Babies expand their world by exploring. They use their hands to place things in their mouth and even try to chew these things. So this is most likely a sign that they're getting more alert. Before we address what teething looks like, let's address some common myths about the signs and symptoms of teething. Firstly, teething does not cause your child to run a fever. If the temperature registers over 100.4 degrees Fahrenheit, then your child is definitely fighting an infection. Secondly, teething does not cause diarrhea or congestion. It's time to consult your baby's doctor if the fever lasts longer than 24 hours and if the temperature registers over 100.4 degrees Fahrenheit. Also, if it is accompanied with vomiting, diarrhea, or rash, then definitely consult your pediatrician. Then why do some parents feel that they are related? Around 6 months of age, the baby's level of antibodies which are passed on from the mother starts falling down, which changes their immune system. Along with the tendency to put things in their mouth, this makes them more prone to illnesses. Some common childhood illnesses present themselves as changes in sleeping and eating patterns as well as fuzziness and are often mistakenly linked to teething. If your child has any of these signs or symptoms, then make sure that they are not suffering from any other possible causes like bacterial or viral infections or even middle ear infections. It's not hard to tell when your baby is teething. At this point, your baby might be irritable during the daytime and sleepless at night. Consequently, you might be too. Teething takes about 8 days, which includes 4 days before and 3 days after the tooth comes through the gum. At this point, you might see a blue-gray bubble on the gum where the tooth is about to appear. This is known as an eruption cyst and usually goes away without any treatment. During this time, it can be tough to keep children comfortable. Some of the normal signs and symptoms which are seen during the teething process include fuzziness, irritability, swollen gums, drooling which is more than normal, loss of appetite, loss of sleep, wanting to suck on and bite onto everything, as well as crankiness. Teething pain makes babies grumpier than usual and your little one is going to make sure to let you know it. The symptoms which are not normal include fever, diarrhea and rash. If your child has any of these symptoms along with teething and appears to be cranky and uncomfortable, then make sure to consult your pediatrician. So, as you can see, there is no fixed set of signs and symptoms with regards to teething. So, how to soothe a teething baby? You can begin by gently massaging the gum area with a clean finger or a soft wet cloth. The next is a time-tested remedy, that is a chilled teething ring. Make sure that the teething ring is chilled and not frozen. Do not sterilize a plastic teething ring by putting it in boiling water or a dishwasher unless specified by the manufacturer. Be sure to read product information before buying any teething rings. Avoid the ones that contain plastics known as phthalates and go for the ones which are BPA free. You can also give unsweetened teething rusks as well as sugar-free teething biscuits to infants who are above the age of 6 months and who have started solid foods. You could freeze fruits and put them in a mesh feeder like chunks of frozen bananas, apples or pears, or even frozen fruits like grapes, blackberries or even watermelon. For babies who are below the age of 6 months and who have yet not started having solids, you can try giving them frozen popsicles made of breast milk or formula milk. Make sure to use popsicle forms that are BPA free. Also keep a bib around as things might get a wee bit messy. Excessive drooling during teething can lead to irritation of the skin around the mouth, particularly the chin. Gently wipe this away with a clean cloth throughout the day. You could also use over-the-counter analgesics, but just like any other health concern, make sure to consult your pediatrician before giving your child any kind of medications. You could also try the washcloth trick with a twist. Place a small piece of clean cloth in a refrigerator for a couple of hours, dipped first in either water or chamomile tea. This will give an added benefit of helping to soothe and calm your child. In fact, nursing mothers could drink chamomile tea themselves or any other natural flower-based remedies, as the benefits of these herbs and flowers could pass on to the baby through the breast milk and help to calm and soothe them. You could also try to wear your baby more often. This will not only help to comfort your baby, but even you. I cannot stress enough the importance of physical touch, which brings me to my next point, that is the use of acupressure in helping to soothe a teething baby. So here are a few guidelines to get you started. Use acupressure 2 to 3 times a day and for not more than 15 minutes in total. Massage the acupressure points with gentle pressure using small circular motions. Do not spend more than 15 to 20 seconds on any one acupressure point. So, which are these acupressure points? The first point is on the outer side of both the forearms and just 3 fingers above the wrist crease. Another point is located just under the thumb on the palm side of the wrist. I would also like to discuss the sleep-inducing point, which is one of the most effective acupressure points to be used in an inconsolable baby. If you have addressed all the usual causes of wakefulness, that is hunger, diaper, warmth or gas, then it's time to use this point. This point is located on the center of the forehead, about 1 centimeter above the eyebrows. Use a soft light stroke for anywhere between 10 to 20 seconds. The best part about acupressure is that you can use it anywhere, inside the house or outside. So moving on, last but not the least, let's discuss some treatments that should be used with some caution or not at all. The first being the use of amber teething necklaces. Amber is believed by some people to release healing oils on contact with warm skin. These oils are supposed to have an analgesic or soothing effect. Although designed to be worn around the neck, ankle or wrist, they are incorrectly used for chewing, which can lead to choking as well as strangulation hazards. The second is the use of teething gels. Some formulations might contain an ingredient called choline salicylate. Salicylate is related to aspirin, and aspirin is not recommended for use in children under the age of 16 years, as it can lead to a condition called as Ray's syndrome, which is potentially life-threatening and could lead to liver and brain damage. Some teething gels may also contain benzocaine, which is not recommended for use in children under the age of 2 years. It is sold over the counter under the names of Ora Gel, Baby Ora Gel, Ora Base, Hurricane or Anbesol. FDA warns against their use as it can lead to a rare but fatal condition known as methemoglobinemia. Research also suggests that it's not the use of teething gel that provides relief during teething, but the act of massaging the gum that actually provides the relief. FDA also urges parents to not use homeopathic teething tablets as they may contain belladonna, a toxic substance. Lab testing has found inconsistent amounts of belladonna, far exceeding the amounts which are claimed in the labels. The body's reaction to belladonna in children under 2 years is unpredictable and may even lead to seizures. Remember that you're less anxious when you know what to expect and there is light at the end of the tunnel, only that there are two tunnels because when your baby teeth fall out, your adult teeth come in. However, this too shall pass. It's only when the teeth come in that the real work begins. Stay tuned for more information on a child's first visit to the dentist in my next video. In the meantime, keep smiling and namaste.